Have you ever wondered what's really going on inside you when you get a stomachache? Well, today we're taking a tour of one of the busiest, most complex regions in your entire body, the abdomen and pelvis. We're going to look at the map doctors use to navigate, the incredible wiring that controls everything, and the powerful muscles that keep us all moving. So, let's kick things off with a pretty foundational question. When you point to your stomach and say, "Ow, it hurts right here," how does a doctor translate that into a precise location inside your body? Well, they use a map, a kind of conceptual grid that they overlay right on top of you. Here's a quick look at our itinerary. First, we'll cover the big picture, that map of your abdomen. Then, we'll trace the nerve pathways, which are basically the command center. After that, we'll get into the muscles and some surprisingly important anatomical landmarks. And finally, we'll take a deep dive into the amazing world inside your gut. Okay, first up, let's explore how doctors create this blueprint of your abdomen. This map is what allows them to figure out exactly what's going on inside, often just from looking at the surface. So this is it. This is the map. And honestly, it's basically a tic-tac-toe board drawn right over your abdomen. For example, if you have pain in that upper middle square, the epigastric region, that could point to a stomach issue. But pain down in the lower right, the iliac region, that's a classic sign of appendicitis. It seems simple, but this grid is an incredibly powerful diagnostic tool.
So how are these 9 regions actually created? They're not just random. They're formed by the intersection of 4 imaginary lines. You got 2 horizontal planes, the transpyloric and subcostal, and then 2 vertical planes that drop right down from the middle of each collarbone. These are the grid lines on our anatomical map.
Now, one of these lines, the supracristal plane, which you can find by connecting the highest points of your hip bones, is incredibly important for doctors. Why? Because its location lines up perfectly with the L4 vertebra. This makes it a critical landmark for safely doing a spinal tap, ensuring the needle goes in the right spot and avoids the spinal cord. It's a perfect example of how the surface of your body gives clues to the delicate structures deep inside. Okay, so we have our map. Now, let's look at the intricate wiring that powers this whole region. We're talking about the nerves, the body's command center that's constantly sending signals for movement and sensation all throughout your abdomen and pelvis. Let's start with this thing called the sacral plexus. You should really think of it as a major electrical substation for your lower body. A bunch of different spinal nerves come together here, weave into this complex network, and then from this central hub, all these major nerve cables branch out to power everything in your pelvis and legs. Right out of this main substation, some smaller nerves branch off directly to control these small but really crucial muscles deep inside your hip. These are the muscles that help you rotate your leg and, keep you stable when you're trying to stand on one foot. But the undisputed superstar that comes from the sacral plexus has got to be the sciatic nerve. This thing is a beast. It's the longest and widest single nerve in your entire body. It runs all the way from your lower back, down your leg, to your foot, and it's responsible for a huge amount of muscle control. And this massive nerve eventually splits into 2 major branches. The tibial nerve heads down the back of your leg. It's what lets you do things like stand on your tiptoes or press the gas pedal. The common fibular nerve takes a different path, wrapping around to the front and side. That's the nerve that lets you lift your foot up so you don't trip when you walk. So we've seen the nerves that give the commands. Now let's talk about the muscles that actually carry out those orders. We're also going to explore a couple of small but incredibly important anatomical triangles that every doctor needs to know. Okay, let's start with the glutes. We all know the gluteus maximus. It's the powerhouse responsible for big movements like climbing stairs. But the medius and minimus, they are the unsung heroes. They attach to the side of your thigh bone and are absolutely essential for keeping your pelvis level when you walk. Without them, you'd pretty much waddle like a penguin. Now for a key landmark. Tucked away deep in your groin is a tiny region called Hesselbach's triangle. It's not actually a muscle, but an area defined by the borders of other structures, the edge of your six-pack muscle, a big artery, and the ligament that makes the crease in your thigh. So why do we care about this tiny triangle? Well, here's the deal. Hesselbach's triangle is a naturally weak spot in the abdominal wall. There's just not as much muscular support there, which makes it a prime location for something called a direct inguinal hernia, where stuff from inside your abdomen can push through. And there's another one of these important triangles. This one's up near the liver, called Calote's triangle. For surgeons who are removing a gallbladder, this small area is like a danger zone. They have to be incredibly precise and identify everything inside this triangle to avoid making a huge mistake. It's a critical roadmap for a really common surgery. All right, for our final section, we're going from the big picture to the microscopic. We're going to journey deep inside the gut to see how it works on a cellular level. It's pretty amazing stuff.
You'd think absorbing something like vitamin B12 would be simple, right? Nope, it's actually this incredibly complex relay race. First, B12 has to hook up with a temporary partner, our protein. Then it ditches that for a more permanent partner called intrinsic factor. And only that specific complex can get absorbed at the very end of the small intestine. It's like a perfectly choreographed, multi-step molecular handshake.
The gut is way smarter than we give it credit for, and that intelligence starts with how we taste. For sweet tastes, which usually mean, hey, here's some energy, we have just a couple of specific receptors. But for bitter tastes, we have a whole arsenal of different receptors. That's because bitterness can be a sign of poison, so our body has evolved this incredibly sophisticated alarm system to protect us. Of course, with all this complexity, sometimes things can go wrong. A rare type of cancer called a GIST, or gastrointestinal stromal tumor, can actually develop from the very cells that act as the gut's pacemaker. You know, the cells that control the rhythmic contractions that move food along. Figuring out how to diagnose and treat these requires a really deep molecular level understanding of the gut. Speaking of the gut's rhythm, what do you think this number is? 12 per minute. What's that about? Well, that is the fastest the gut's rhythm can go. You'll find this frantic pace in the duodenum, which is the very first part of the small intestine, right after the stomach. It's where the most intense part of digestion kicks off. Wow. So from anatomical maps and massive nerves to microscopic triangles and molecular handshakes, we've seen just how layered and complex the abdomen and pelvis really are. And this tour, it just scratches the surface. Which really makes you wonder, right? What other incredible hidden systems are coordinating inside you right now to keep everything running?